friends, welcome to my channel. My name is Veronica, and today I'm going to tell you my story about my hip replacement surgery. And this will be my comprehensive guide, my step-by-step process, and my experience. Stay with me. I'm going to cover the week before the surgery itself, as well as 3 weeks after the surgery and my progress. If you ever have to do that, at least you'll get a glimpse of how other people go through this experience, what they do, what they're expected to do, and how they feel overall. So here's my story. I'm a 44-year-old female, and the last couple of years, after doing a lot of aerobics and kickboxing and just very, very intense sport activities, I noticed some pain in my left hip. And at first, I didn't really pay attention to it until it started getting worse and worse. So I went to see a doctor. I went to see a physical therapist and some surgeons who actually told me that on my x-rays, my hips look uneven. And they saw the signs of developing arthritis. So they told me it's probably too soon to operate on me just because I'm so young. And most people who get the surgery are in their 50s or 60s. So it's not recommended to do it young. But some of you know, and some of you did get a surgery done really early in your life due to different circumstances. Everybody has their own problems, I guess. With my developing arthritis, I had bone on bone. And over time, almost every month, I could feel how it was getting worse and worse and worse. And over the last 2 years, I was just walking around and waiting for the time when the pain was so unbearable that I will have to go and do the surgery. And that's what I pretty much did. I like to stay active, and I was active my whole life. And it was really hard for me not to go hiking, not to do yoga, not to work out in general. And even for long walks, after like 5 or 10 minutes, your hip starts hurting so bad that you really cannot continue walking. So running is completely out of the question, or jogging. So I had to stop working out and I had to stop exercising. Because of that, I even gained some weight, and I'm not happy about it. I gained maybe 20 pounds over the last 2 years because of lack of exercise and just dealing with the pain on a daily basis. I also live in a townhouse with a lot of steps, and going steps up and down every day is a lot of hassle. I have 2 younger kids, and they make me run around. So it is not that easy, especially when you have pain in that hip where it's hard for you to walk that much or go up the steps constantly throughout the day. So at some point, the doctors gave me some medications, and they said that I need to take that for pain and for inflammation. And I did that. I did that for about 6 months, and then I realized that the medication is not helping me to release the pain. When the pain gets extremely bad, or at some point if I walk too much or have some kind of activity that I have to do and it hurts, so I do take a big dose of ibuprofen or Tylenol in order to help the pain. As my pain got worse over time, it was harder for me to walk, the pain was getting worse, I decided to do the surgery. 4 months ago, I went back to the surgeon and I asked him, can you please operate on me because I cannot put my socks on. I cannot even go for walks. I cannot do anything. I'm just living with pain every day and I'm dealing with it. And they agreed, thankfully. So now I have a surgery this week. When you're planning a surgery like this, keep in mind that you won't have any downtime. As soon as they operate on you, you will be expected to walk. You cannot sit or lay down. You won't be staying in the hospital for any nights or any additional days. It's pretty much outpatient surgery. They do it for a couple of hours. They put you to sleep. They do the surgery. And then as soon as they wake you, you have to walk. And you will have to do that walking every day, every hour. You have to do some exercises. They will send a physical therapist to your home after the surgery. Maybe the first week that you will have a visit once or twice just to show you some exercises, to see your progress. But overall, there won't be an expectation of physical therapy after the hip replacement. You'll have to go to your physician, do your physical visit, do your blood work so that all of your pre-op testing is done. Then you'll have to take a class where they will teach you what to expect before the surgery, during the surgery, and after the surgery. They will talk about different tools that you can use after the surgery. They will talk about medications. They will talk about pain management, exercises. And that class will take about 2 hours. So in your local hospital or wherever your surgeon is going to send you. And that class is mandatory. So you cannot go to the surgery without taking the class. There are a lot of stories on the internet, on YouTube, how others are doing it and what they were expected to do and things like that. But not many showed additional details. They were just talking about how they felt after the surgery. And they didn't really show pictures or anything like that, because as a woman, I am worried about the scars. I'm worried about how soon can I get back on my heels, how soon can I start exercising again, because I like to stay active. And for a young woman like myself, there's so many things I want to do that I was not able to do for the last 2 years. So make sure you have the list of those questions you can ask your surgeon, and make sure you do some research in advance to know what to expect and know how much time you'll be out. Maybe if you have a job where you have to go to the office or to the factory where you have to be on your feet. They told me that I will not be able to drive the first 2 weeks after the surgery. And it is a concern for me, primarily because of my children. So I have shared custody for my kids, and I have to have them half the time. And not just have to, but I really want to see them after the surgery. And I might not be able to, because I will not be able to take care of them. I will not be able to drive them to school or to their sports activities. So my children will stay with their father. Thankfully, my job is from home, so I don't have to go anywhere to the office. That's definitely a blessing. But for many of you, it's probably not the case. You probably expected to go or report back to the office after your surgery. So give yourself some time. You will need to maybe work from home or take it slow. So definitely consult your physician, consult your doctor, talk to your manager at work, and see if you can come up with some schedule that is flexible and that will work for both of you. After the surgery, they will put a special padding and special sealant on your scar, so you won't be able to take it off. You won't be able to take a bath, but you can shower with it. So it should be all sealed up and no moisture will be going in there. But it has special medication on your scar, so everything heals up faster. When you're planning for the surgery, have your house set up, or maybe stay with a friend that has one level or minimum steps in their house, and somebody who can keep an eye on you for at least the first couple of days. Under all those antibiotics and pain management and medication, you might be a little bit dizzy, foggy. You cannot drive home from the hospital by yourself. So make sure you arrange some transportation, ask your friends or family to take you home, and maybe you can stay with them for the first couple of days, or maybe the first week and a half to 2 weeks, to make sure that somebody can assist you and you don't fall, you don't hurt yourself, that you can take a shower with somebody being around in case you fall. If you're staying home and somebody's taking care of you, you won't be able to do much. You will be able to walk, so you will not be able to do the drive, or go to the store to get groceries, or cook, or clean, or do laundry. So if you're living with someone, if it's your husband or your friend who's taking care of you, all those chores will be on them, not on you. So as you're preparing your house for the surgery, make sure you get a couple of tools that will help you in this process of the first couple of weeks after the surgery. Things like shoehorn that you can put your own shoes on. At the hospital, they might give you the device that will help to put socks on, and they sell it on Amazon as well. Then you'll have to buy good grip shoes, whether it's Snickers or something that has the back, so you don't slip out of them and you're comfortable doing your walks. Ahead of time, do some practices of how you're going to sleep after the surgery. You can be a back sleeper, you can be a side sleeper. You won't be able to sleep on your stomach. So you will probably need to practice beforehand, so when after the surgery, you will have a little bit of a habit of how you're going to sleep. A couple of pillows I purchased is this pillow that goes under your legs, because you get really sore just laying on your back all the time. You want to stretch, you want to have a different position, and sometimes you don't have a lot of options. You're just going to be sleeping on your back for the first couple of weeks after the surgery. I'm a side sleeper, so for me it's challenging and very uncomfortable to always sleep on my back. So I bought this pillow in order to get more comfortable, because you can put it under your knees, or you can actually lift your legs over there and have a little bit more comfort, whether you're watching TV or just laying in bed. If I wanted to lay on the side, I use this pillow to put between my legs, because then it's extremely comfortable. You cannot really twist your torso too much. So what you have to do is you have to use your side muscles in order to turn your whole body to the side, like this. So that's what I do in order to lay on the side. And then this pillow is wide enough for me to kind of keep my legs apart, and at the same time gives enough comfort for this leg to rest on. But I gotta tell you, the first 2 weeks I cannot sleep this way. It's been very uncomfortable, because where my scar is on the posterior side, it kind of pulls my skin and feels uncomfortable when I'm laying like this for extended periods of time. So I've been trying not to lay on this side that much, only just a little bit in order to give myself a little bit of a comfort, because I do like to toss and turn when I'm sleeping. So I use this pillow just to give myself a little bit of a break from the back sleeping. And it's usually what, maybe 15-20 minutes I'm going to lay on this side. And of course I cannot lay on this side yet because this is where my scar is. But at the same time, I still feel the pressure. I still feel the pull of my skin. So it's not the most comfortable position as I thought it would be, or was hoping to be. This pillow I also purchased in order to sleep on the side, because I do love sleeping on the side. And what you do is you put this pillow between your legs and also turn, but I didn't find it that comfortable for me. Especially now when I'm still healing up and I'm sleeping mostly on my back. So I don't really use this pillow in order to put it between my legs. What I do with this pillow is I help myself from the back. If I'm laying on my side, I put this pillow pretty much under my butt, so it holds it, or it gives additional cushion, and where my butt is not up in the air. So it gives me some stability and some additional comfort. The other thing that I have from all my travels is a special funnel for the bathroom. It's a female funnel. If you don't want to sit on the toilet or don't want to sit just to go pee, you can actually use a funnel, and it's a very, very convenient tool. This way I won't have to really struggle to go to the bathroom every single time, or worrying or falling or anything like that if I'm going to the bathroom by myself without any assistance. So here is the ladies funnel I was talking about to go to the bathroom. Especially if the first couple of days it's hard for you to go up and down, to sit down, to urinate. So you can use one of these things. In this bag you have one of these, and also an attachment in case if you're in the car and you want to pee in the bottle, pretty much. The other thing that I also purchased is this daily briefs with a tab, because I'm not sure how I'm going to feel about pulling on the underwear the first couple of days. So I want to have something like a daily brief where I don't have to worry about pulling your underwears up or down. This way you can just pull them off on the sides or put them up without bending. And I think it's a great way to do so. So I'm going to try them out and let you know how it goes. If you can afford to purchase the special toilet seat with the railings, you should definitely do so, because in the first couple of weeks, or maybe even the first month, it will be a little bit hard for you just to sit down without holding on to anything. So it's nice to have a little bit of a rail. Maybe you have a rail in your bathroom already. So just make sure you have your house prepared and you have something for that. I only have a couple of days left before the surgery, and what they give you as instructions beforehand is 4 days before the surgery you will have to wash yourself with a special antibacterial soap. So they will give you the soap, you will have to bathe yourself in the shower with the soap, you have to scrub your skin to make sure there is no bacteria, and you get your skin prepared for the surgery. This is the soap they gave me at the hospital during the class, and this is the soap that I'll have to use 4 days before the surgery and the morning of the surgery. This is antibacterial special soap in this packaging. So I'm going to show you how it looks like. So it comes in a package like this. It has a soft sponge on one side and a scrubby surface on the other side. This part of the brush is pretty soft, so it's not going to leave any scars or any scratch marks on your skin. So when you're taking a shower, you'll have to scrub yourself from the neck down, especially the areas where they're going to operate on. So I'm going to shower with this tonight as well. Also make sure you wash your sheets and you have clean sheets after the surgery as well to minimize that bacteria. You'll have to hydrate yourself 48 hours before the surgery and take some medication the day of the surgery, like Tylenol. They also ask you to stay away from any kind of medications that are blood thinners. But you will need to consult your doctor if this is something that you're taking on a regular basis, and they will have to give you instructions of how to handle that medication before and after. A very important tip that nobody told me until last minute was the fact that you cannot go to the dentist before or after the surgery. You cannot go before, like 4 days before the surgery, you cannot go even to teeth cleaning, and you cannot go to the dentist 3 months after the surgery. The main reason is the bacteria in your mouth, and it's different than any kind of bacteria that is on your skin. So the cuts are not recommended, but it's not as bad as the cuts in your mouth where all that bacteria lives. a few days before the surgery, make sure you stop using this on any parts of your body. You will also need to take any jewelry off before you go into the surgery. You will also need to refill your prescriptions in advance and have all of your medications ready to go before the surgery. Things like Tylenol, aspirin, some pain medication that the doctor prescribes, and some other things that you might need to be pre-filled in advance, so you don't have to worry about it after the surgery. One more thing that I purchased online was the scar cream, and that's good for the day or nighttime. So after my stitches are removed, I will start using it. It's going to be an outpatient surgery for a couple of hours. So I will need to report to the hospital or outpatient facility a few hours beforehand so they can prep me. So I'm going to the hospital around 10 a.m. and then they will do the surgery on me around noon or 1 o'clock. And after that, after the surgery, once they wake me up, they will help me walk. They will show me different workouts, and pretty much from then on, I'll be free to go home. I will have somebody to pick me up as well, because remember, you cannot drive after the surgery, or you cannot drive the first 2 weeks after the surgery. So I'm in the hospital now about 3 hours before the surgery. They're getting me prepped, giving me IV, and I'm going to wait for the doctors. I could not eat this morning. I just drank a little bit of water before 10 o'clock before arriving to the hospital, and the whole process was pretty quick. So this is day 2 after the surgery. Last night was a little bit rough with some pains and aches at night, although they gave me some heavy medications for pain management. So every time I was trying to turn around to move on the bed, I had some pain, so I would wake up every single time. Went to the bathroom once. The hip feels pretty stiff. Now it's going to take some time for me to recover. Certain moves you're not allowed to do with a brand new hip. So you cannot cross your legs, you cannot lean forward, and if this is your broken hip and the one that you just had a surgery on, you cannot put that left foot inside. So you can only keep it straight, or you can do a little bit this way when you're laying down on your back if you're sleeping, or that your hip does not get displaced. So to sit down in the chair, you will need to kick one leg out, the one that has had the surgery on, because you don't want to have the 90-degree angle. That's one of the restrictions. So when you kick one leg out, you should have handles on your chair and sit yourself down this way. So now to get up, again, I'm going to use the handles here on the chair, and I'm going to kick this leg out, the one that had the surgery on. And I'm going to push myself out of the chair with my hands. So this is day 3. The medication is making me a little bit nauseous. So you definitely have to eat something when you take the medications, especially those pain management medications that are heavier and stronger on your body. So everything still feels pretty stiff. There is still some pain, so I have to take the pain meds. Walk a little bit more today, so I'll try. But it hasn't been any better today. I don't see much of a progress. So I should move more and definitely eat with the times when I take my meds. So this is day 4 of my recovery time. And it's a little bit easier to get around. And this is probably the first day when I can get up on my own from the bed and wash myself, dry myself off, or use the bathroom. So I still have some stiffness, some pain. I'm still taking some medications. It's getting a little bit easier, a little bit better. Not much, but a little bit is a good progress already. So the first 5 days of the first week, you will not be able to cook for yourself. or even get dressed. So keep in mind that you will need somebody to help you out with that. With all those restrictions on bending, it's a little bit tough to do things on your own. So if something falls on the floor and you cannot bend, you cannot get it, you need to call somebody to help you get it off the floor, or help you walk to the bathroom, or get off the bed. So those first 4 days will be very challenging, and you will need that 24/7 support from somebody, maybe your family member, your friend, or your significant other. So today is day 7, and I'm finally actually feeling less numbness and less pressure on my hip where the surgery was. So as you see, a week later, I don't have any pain, so I don't really take painkillers anymore. I still have stiffness, but it's a lot less, so I'm very excited about that. And the other thing is, it's a lot easier for me to get on the bed and off the bed by myself, but I can definitely notice the progress after this week. And as far as walking, it's a lot easier for me to walk with a cane. Actually, I can even walk without the cane when I'm at the house. It is a little bit hard for me to put pressure on that leg and walk straight, because with a cane, it's a lot easier to walk than without a cane. So check this out. That the numbness can take up to 6 weeks. So if after the first week my numbness is so much less than it was, of course, a few days ago when it was associated with pain as well. So now I don't have pain, only the numbness, and I hope that it will slowly go away before the 6 weeks are over.
Alright.
Yeah.
I'm sure how good that decision looks.
Bend this one for me. Gently raise that one up without bending the knee. Keep it, yeah, just raise the foot up. Perfect, great. Let your knee relax. So I don't really want you doing that too much. Let your hip come up. Relaxing. Where do you feel it? Here? Somewhere? All around? Yeah. Roll over on your right side. Swollen, but not.
So I just had an appointment with the doctor that is 2 weeks after the surgery, and he said I was doing great. My staples got removed. Now I can see my scar. I've been moving much better. I do more exercises. And he told me that because of my age and because I'm being rather strong compared to some other patients of his, that I'm progressing much faster than others. That means that I can do a lot more things in terms of workouts, and I even do some elliptical workouts right now. Not long, maybe 5 to 10 minutes a day or so. And I actually started practicing walking up and down the steps. And I'm going to show you how I do that. But the initial restriction that they put on you when you go up and down the steps is you have to go up the steps with the healthy leg for your hip to be comfortable. And you're going down with the operated leg. I live in a townhouse that has 3 floors, so I do have to do steps a lot. In my case, it takes a long time to go up and down the steps. And I'm going to show you the way you're supposed to be walking the first probably 4 weeks after the surgery. So I do go up with the healthy leg like this. I was going down with my operated leg all the time in order to go down the steps. But as my legs and my muscle get stronger, I can try to go both legs up and both legs down. This is the beginning of week 3 of my recovery, and I'm trying to do it now so that you can see the progress. Couple of pieces of equipment at home so I don't have to go to the gym. I do have a treadmill, but I think it's a little bit too soon for me to get on the treadmill because the treadmill requires you to walk a little bit faster than normal. Right now my normal is rather slow, so I don't think I'll be able to keep up with the treadmill. For now, or actually yesterday and day before yesterday, I started doing the elliptical machine that is right behind me. So on the elliptical the first day, or it was at week 2 mark, I started doing 5 minutes in the morning and 5 minutes of elliptical in the afternoon or in the evening. Yesterday, I did it only once for 10 minutes. And it felt pretty good, especially when you're going like this with your legs. It was actually rather comfortable. It wasn't painful. It wasn't straining on my muscles. And I wasn't super sore after it. So today, I'm going to do 10 minutes on the elliptical. So first of all, I'm going to show you how I get dressed by myself without anybody's help. So you will need a couple of tools, and I did purchase this one online. They also give you one of these in the hospital so you can put your socks on. So it's pretty easy. You take a sock and you put it all the way on it. You lower it down. You pull off this thing here. Here you go. One sock is on. The other sock I can probably put by myself, but I will use this tool as well. Okay. So I'm putting the second sock on. There we go. To put the pants or underwears on, there's also a tool for that. That's also very handy. So I'm going to put the pants on with the help of this little tool. First, I'm going to put the operated leg in the pant. So what I usually do is I throw it on the ground and I got my foot in it. Then I take this grabber here and pull it on my leg, wherever I can reach it. And then with the second leg that is healthy and not operated on, it's a little bit easy to maneuver and put that leg in the pant, or you can use the grabber as well to get it situated and get it pulled up. So I'm going to try to put my foot in it without the grabber. There we go. As long as I can reach it at the knee level, then I can definitely pull it up. And then of course you can use the grabber in order to adjust or fix the pant on the back. You can grab it in from the back and pull it up. But I usually try to pull it up to my knee, and then it goes up. I'm going to leave the link to this product on Amazon. So if you didn't get it at the hospital or you don't have it, get it yourself. It's not very expensive, but it's very helpful. I use it daily for dressing up, for reaching something on the floor because you cannot bend all the way. So if something falls on the floor, either a sock or a piece of paper or anything else, you can definitely grab it with this thing, or even use this tool that has a little handle here. You can pull off your socks with this tool as well. And for the socks, if it's winter time and you do need to wear socks, this is also a very handy tool, but that's the way you put socks without bending over or without anybody's help. So right after the surgery, it's really hard to do any intense exercises, but you have to work out your legs. You have to let the blood flow through your leg, especially the operated one, so you don't have any clot. Online, I found a couple of neat exercises that are very easy to do when you're laying in bed, that you can stretch your legs, you can stretch your toes, your muscles with, and I'm going to show it to you. The first one will be just stretching your toes up and down with both legs or with one leg. The other thing is the lift for your calves. And all you do is just this. Goes up. At the hospital, they also gave me this little tool that holds your leg, and it's comfortable if whether you had a knee surgery or you had a hip replacement, because this tool helps you grab your foot to move it for either exercises or to get in bed or out of bed. So I use this tool for a neat workout in bed, because if your leg is not that strong yet, it's hard for you probably to move it back and forth to do the exercises if you're not standing up. So I use this tool for my workouts. So what I do is, you're going to move your leg, and this is my operated leg, to the left. So this is the end of week 3, and I'm about to start using the Mederma cream for my scar. So I purchased this online. There is a daytime and nighttime cream. So now I'm going to summarize this last week, week 3, with the last 3 weeks of recovery. The first week of recovery was pretty tough. It was hard for me to sleep at night, to get comfortable, because I did have some pain, so I had to take some special pain medications. I also used the walker and the cane for my walking, for my exercising, and just to move around the house, to go to the bathroom and things like that. So I'm going to leave a link in the description below, actually multiple links for you, for all these products that I've been using. You probably are going to get a couple of tools from the hospital to help you with your recovery. But if you don't, you can order them online on Amazon. The doctors might recommend you to rent a walker for the first couple of weeks, or at least the first month. I'm still using the walker. I'm not really walking with it, I'm using it for exercising. You will be using the walker a lot the first week, just to move around, to get your strength and be able to get up. During the week 2 and 3, you will be using the walker for workouts and for your exercises to keep your balance. So it can be very helpful. So the first month for sure, you will be using this walker. The other thing about this walker is it folds. So you can put it away if you're not using it. Maybe you will still need it at some point in the future after your full recovery. The other thing that was extremely useful was the cane. So I found this cane on Amazon, and this one folds. So it's easy to take it with you, put it in your bag. But the other thing I've been using it for is to get in the car and pull the door closed. Because when you start driving and you have to get in the car in a certain way, you have to keep that 90-degree angle for your legs, so you cannot really bend, you cannot lean over to close the door. So I've been using the cane in order to close my door to the car. I started driving around week 2. I know that I was not supposed to do so, but I didn't have an option, I didn't have that choice. So for me to get in the car was not really an issue. The issue was, how do I reach that door? Because I cannot lean over to close my door. So I've been using the cane in order to pull the door towards me and lock the car. Even after 3 weeks, I still have some soreness and some numbness, some stiffness in my hip. So it's really hard to sleep. The first week was almost impossible. My back was really hurting. I couldn't turn around. I really cannot sleep on the side that is operated. But on the other side, you would think you can probably lay down on the other side. But I really couldn't because the stitches, the scar was really hurting me. Even though I would not be laying on the stitches and the scar, I would be laying on my other side. But for some reason, it would pull my skin, it will pull my muscle. So I was extremely uncomfortable. So I was forced to pretty much sleep on my back for the whole time during the first week and most of the second week. This is actually the end of week 3 when I started sleeping on my non-operated side and I feel comfortable. But regardless, I still need the pillows. So I purchased a couple of pillows on Amazon. I'm going to leave the links to those pillows for you to check them out as well. But I pretty much use those pillows for sleeping, for support. Not only putting a larger pillow between my legs when I'm sleeping on my side, but also putting a smaller pillow under my buttocks or under the area where it was operated, so I'm a little bit more comfortable, so it provides the support. So the pillows for my sleep were absolutely essential. I'm still using them, and I'm probably going to use them for a while until my scar tissue and until my muscle heals. One of the most essential things for ladies especially was the funnel that I've been using to go to the bathroom. For guys, it's not a big deal, but for ladies, every time you have to go to the bathroom, you have to sit down and you have to maintain that 90-degree angle in order to sit down. So it's a little bit more maneuvering. It's not very comfortable because the toilets are rather low. I don't have that special seat or that special higher chair over the toilet, so I can easily sit down. So for me, going to the bathroom every time was a challenge. So I fixed that challenge by using the funnel. So every time at night when I go to the bathroom, to this day, this is week 3 or the end of week 3, I've been using this funnel every day. And because it's used for hiking, it has a little pouch it comes with, I can take it with me on the road. I can put it in my purse if I'm going to see the doctor, if I'm going shopping, if I'm going anywhere to get my children. I bring the funnel with me because if you have to use a public bathroom, then you don't have to worry about sitting down or maneuvering or hovering over the toilet. So the funnel was absolutely critical in my recovery. If you're recovering during winter months, get yourself a shoehorn. I also found a shoehorn that collapses or folds and it's easy to put in your purse. If you're going anywhere, maybe to the doctor's where you will need to take your shoes off, and this shoehorn will be very helpful for you. I also got myself a massager for my back. Sleeping on my back all the time, not being comfortable at night, your back can get really sore and really numb. So using a massager for your shoulders and your back can be very helpful, especially if you want to stretch a little bit. And it has a longer handle, so it's easy to reach your back. So in the morning when you get up, if your back is hurting or it's sore, you can use the massager. They probably recommend it to use ice packs after your workouts, maybe a warming pad before the workout, or if you want to just warm up the area if it's a little bit sore. I've been doing that as well. Thank you so much for watching my video till the end and joining me. I really appreciate any of your likes and comments. And please don't forget to subscribe to my channel as well. Best of luck with your surgery and your recovery. Take care.